Good afternoon. My name is Dr. Andrew Michaels. I'm here to do the foot inspection on your feet. I've been told that you think you have an invasive species in the bottom of your foot from a trip in South America. Is this true? Okay. All right. Do you mind if I examine your feet? Okay. Thank you very much. Just as a precaution, I'm going to put on some rubber gloves. Can never be too safe. And the nurse took your vital signs. Very good. Okay. All right. All right. Okay. You were at Monte Picchu? Is that right? Okay. All right. All right. This might get a little invasive, what we're about to do here. Do you mind if I roll your pant legs up? Thank you. Just to make it, you don't want to ruin your clothing. Okay. That leg. And this leg. There we go. There. All right. And can you raise your legs up and get this cloth to protect your legs and the examination table. There we go. Okay. First off, I'd like to check your skin tone. May I do that? Thank you. Just doing a quick inspection. Are you feeling any pain in your leg? Are you feeling pain if I do this? How about now? Any pain? Okay, thank you very much. All right. You don't have any discoloration on the top of your leg. I think you're all right. It's definitely, the problem lies basically at the bottom of your feet. What I have here is a topical solution, and this topical solution we're going to use to sterilize the bottom of your foot. Does that feel good? It's quite relaxing. All right. Come back to that, and we'll let it sit for a minute, and then I'll wipe it off. Okay, not to alarm you, but we definitely have some activity on the bottom of your foot. I think you're going to be just fine. I have some experience with this sort of situation from my own travels, so I think you're going to be just fine. Just this spray is very good for sterilizing an area. Basically kills 99% of all the germs and bacteria on you. So we're going to just give it a wisp on top, the inside and outside of your foot and leg. to prevent any possible contamination to the rest of your body. And just a real quick spray right there on the top of your arch, kind of like to form a barrier, if you will. So that's that. And when we're done, we'll do this again. Okay. Sounds like it's starting to thunder out. It's quite a roller coming in. I didn't expect a storm today. We haven't had much rain this week. A lot of rain where you live? Okay, very good. Okay. All right. Now, I'm going to make a series of small incisions with my scalpel. I need you to try and remain as motionless as possible. And first we'll give you a shot. There we go, there. And a second shot right there. Okay. I know it's a little painful, hold still. To numb the area. And a shot here. And another shot right here. Okay. And we'll wait a few minutes for that to numb the area while we're doing that. Luckily I don't see any signs of internal bleeding. There's no hemorrhaging. Do a quick inspection. I can tell you take very good care of your feet. Don't be alarmed. Like I said, I've seen this before. And you'll be just fine. Let's get this all ironed out. There we go. Okay. All right. Loosen up the muscle. This is to help get the Novocaine. Your dermal skin on the bottom of your foot is very thick, so trying to get it to move around a little bit. Okay, now I'm going to take a sharper needle, and I need you to tell me if you feel the pinprick. So, do you feel this? No. Okay. Do you feel this? All right. Do you feel this? No. Okay. No. That slightly. Okay. So you feel that all the way down. Okay. So we kind of have a barrier there. You feel that all the way down. Okay. Do you feel this? How about right now? Okay. And the same with this foot. Do you feel that? Okay. Do you feel this? Okay. And do you feel this? Okay. Do you feel this? This? Okay. Right here. You feel that? Okay. And do you feel this all the way down? And the same on the other side. Do you feel that? Okay. How about? No? Okay. And you feel that? Okay. Making sure we get the right area numb. Final check. All right. Now, with my scalpel, we will now make a minor incision in your right foot where the what it is it's a parasitic worm, and we're going to remove it from your body. It's quite harmless. If left unattended, it will eventually come out on its own. There's one incision, two incisions, and four, five, and then, so there's 6 incisions in that foot. Okay. Very little bleeding. Just hold right there. Okay, we're going to pull the worm out of your foot now. There we go. There you go. You can see it. Yes. And put it over here. And now we're going to pull another worm out. There we go. There's another one. So that's 2. Okay. And pull another one out. Making sure I get them put in this alcohol bath I'm holding. Here's the 3rd one. Okay. And I have a bowl here that I'm dropping them into alcohol. You really don't want to see that. Are you feeling any discomfort? Okay. There's the 5th one. Right there. Okay, put in the alcohol. And make sure he's down in that alcohol. Good. And the 6th one doesn't want to come out, so hold still. To get a different angle on him. I can't get this one out. It just won't come out. Okay, hold still. There we go. There's the 6th one right there. He's a big one. We'll drop him in the alcohol. All right. Now, get out our antiseptic spray again. You'd be surprised. This will help your body heal very, very quickly, more than the normal rate. A couple quick squirts. There we go. And a clean, sterile cloth. There we go. You can see, to make you more comfortable, there's no blood on it. The incisions are already sealing from the inside out. And now, just a little bit of lotion to help seal up all the damaged cuts and get them all right. It's almost like good as new. You can almost barely see the incisions I made. And the reason for this is we use an advanced technique to get the bottom of the foot to heal once we get the worms out. And they're all gone. There. Get that lotion down in there. And I know it's kind of thick on here right now. We want to leave that on there as long as possible. All right. There we go. dealt with this before when I was down in South America. Amazon is not a place to be messing around about. There you go. We're just going to get some of the excess off. You can put your dress sandal back on when we're done and walk right out of here. You don't have to. Won't be a problem. Won't be a problem at all. There, how's that feel? There you go. There's just a small cut down here. I think that'll be all right. It's healing. It's a little slower than the rest. There you go. Okay. All right. Now, one more quick shot of this. It's like a final sealant. Here we go. All right. Okay, now we'll consider that foot done. Let that lay there. There you go. And we'll proceed with the other. Your right foot. Okay. First things first. Double check because it took a while. Do you feel this? No. Okay. Get my scalpel out, and we're gonna have to make 6. Let's see, 1, 2, 3, 4, 5, 6, 7. 7 incisions in this foot. So there's one here. There's one. On the heel, 6, right across the heel. That's going to take a while to heal. Okay. I'm going to get that one right away in your heel. Okay. And we're going to have to get, I got my bowl of alcohol here, a new bowl. And I'm going to try to get one of these worms out of your foot. Okay. Oh, hang on just. A little more seepage than the other foot. Okay. All right. Let's try to get this out and pull that one out of your heel first. There's one. Okay. Put it in the alcohol and go get the next one. There it is. There's number 2. And let's try to get another one here. Okay. There's 3. You might see the light. What that is there is a laser that kills this the worm, and then when you drop it in the alcohol, it dissolves. So, okay, get this one. There's a big one right there. That laser cuts right through it, and one there. So that's 4. They don't want to give it up. Try to get them down in that alcohol. And let's get this one right here. There's one there. That's 5. Pull another one. 6. And the last one. Always save the one that's the worst for last. Oh boy. Yeah. just doesn't want to give it up. There we go. There he is. That's the last one. And we'll drop him down the alcohol. There you go. That's not too bad. He was deep. I'm sorry, I almost sneezed on your foot. I'm so sorry. These ones were a little deeper. Okay, there. Some storm. I hope we don't lose our power. I know I'm being a little more forceful on this foot, but I'm trying to get the healing lotion in. Sounds like a war out there. Okay. All right, we're doing pretty good. Get some lotion on there. There we go. Get that nice and loosened up. Now, this will help the healing process immensely. It's amazing. You can literally see it healing right before my eyes. Even that cut on your heel. How's that feel? Feel good? You will start feeling better because your body was producing antibodies to fight off the, not the infection, but the invasion of the invasive species into your foot was causing your body to produce antibodies in liquid to try and hold them back, to try and create a barrier so the parasite couldn't progress any further into your body. And it was almost to the tipping point when you came in. Knead that in a little bit. There, how's that feel? That feel better? Yes? Okay. There you go. Get you to dry off a little bit here. What we're basically doing here is once the skin heals, we want to get this off, the excess off. Even though it lubricates the foot, it doesn't allow the dead skin to fall away, so we want to let the skin breathe. So it's real important. I know you were instructed to wear sandals. You want to wear sandals for the next few days, let your feet breathe and get as much air as possible, or no shoes at all. and you want to keep your feet elevated. And then within 3 days, this should be completely healed. But like, I know you can't feel anything right now. But when you get home, you'll feel a little bit of tingling in your feet. It will almost feel like tickling. Okay, see, you're starting to get your feeling back already. So, do you feel that? There you go. I know it's an annoying test, but the idea is to make sure you are getting sensation in the damaged area. So basically what this, the Novocaine local has been removed along with any infection and any foreign bodies by this lotion. And that foot's already been like in a stage of advanced healing. It's already removed the Novocaine, and you can feel that on your foot. So this is just a silly test to make sure that your foot is not. There you go. Okay, I think that's enough proof that you are indeed getting the feeling back in the bottom of your foot. Now, I don't know if you can see, if you look at the mirror on the ceiling that I have, you can see that your foot is healed. There's no cuts or scars. And this foot too. See that? There you go. Okay. All right. Okay. All right. All right. I just want to put on a new pair of gloves, if you don't mind, to do a final look at your feet. What I want to do this time is basically just make sure that we have feeling. We're going to look for pressure and pain. So I'll get my needle out. Okay, now I have my needle right here. Do you feel that? Feel that? Okay. Thank you. Feel that? All right. We're going to do a pressure test. You push down when you feel it. Push up. Push against my finger. Push against my finger. Does it hurt when I do this? Push down, push up against my hand, push down against my hand, push down, and push up. There you go. Okay. Does that hurt when I do that? Does that hurt? Okay. I was worried about that 1 year heel. Okay, I think we're all right. Okay, I think we're done. I'll consider this a success. I'm going to seal your feet with one more healing spray of this hypo spray. Just a couple sprays to kind of heal your foot. Gently rub that in. There we go. Don't want to neglect the bottom of your leg. Okay. Same on your other leg. And this will help your legs remain germ and bacteria free. until they're completely healed. And I wouldn't, you raise this leg, I would not wear, roll your pant legs down. Okay. I would not wear socks or stockings until, we'll send you a note home for like 3 days until they heal. At least 3 to 5. So maybe just the rest of the week. Maybe on Monday when you go back to the office, you can wear any kind of shoes you want, or foot covering won't be a problem. But until then, I would wait. And as I said, you'll get a full write-up with instructions for the next 5 days. It's really 2 to 3, but I think you should just stay on the safe side and go. If you go 5 for the weekend, then Monday you should be perfectly fine. And I think you have a checkup on Tuesday. So basically, what we want to see is you doing everything normal, and above all, in the evening, please elevate your legs. If you're watching TV on the couch, put them on the armrest of the couch. Not too high, just about a 10 or 15 degree elevation. And at night, try to sleep with a pillow under your legs from the knee down, just to keep them a little bit elevated to help the healing process. Okay? All right. My name is Dr. Andrew Michaels. I'm glad I got to meet you today, and I wish you the best of luck in the future. And always remember, don't go barefoot in the Amazon or the mountains of South America to avoid any kind of invasive species that your foot can't handle. Okay? And until then, please have a most blessed day, and I hope to see all of you soon. Bye-bye. Bye-bye. Okay. All right. And we are done.